Madam Chairman, members of the committee, my name is Ken Meyers. I live in Portland, and I'm a volunteer for Healthcare for All Oregon. Here today to ask for support for Senate Bill 631. In more than 50 years as a healthcare administrator, I'm one of those bad guys on that red chart. I've seen a lot. I worked in community hospitals, military hospitals, university hospitals, large healthcare systems. And when I started my career back in the 50s, I'd recently graduated from Berkeley, and I was an idealist, and I thought I could go out and help people secure health care and make it good for them. I soon learned how difficult that was. My first job was in a business office, and one of my first duties was to go up to the pre-op and have a guy sign away his house before they'd take him into surgery. And it's only gotten worse. The problem has gotten so severe because healthcare is not considered a right, it's considered a commodity, and it's sold, and more so, it's sold at a profit. Back in the early days, the insurance was handled primarily by Blue Cross Blue Shield, nonprofit. They had reasonable premiums. They did a good job. But nowadays, there's huge for-profit insurance companies that are making billions of dollars for their shareholders. It does nothing for our healthcare system. They do that by limiting their risk pool, which has been talked about, minimizing their coverage, denying claims, charging substantial premiums. It's just a scam in many ways. Most community hospitals back then were nonprofit. They provided their share of community charity care. Now there are many large for-profit hospital corporations. They target paying customers, avoid offering unprofitable services, and they make millions and billions. Even the nonprofit hospitals got into the free enterprise spirit of competing for patients by duplicating expensive services, avoiding those that attracted charity care patients, ER, maternity care. Under pressure from doctors, hospitals grew bigger and more expensive. Highly specialized services were very costly, but they provided large incomes for hospitals and the doctors. The fee-for-service payment system encouraged overutilization because providers could increase their income by simply seeing more patients, providing more services. When I started, drugs were only a minor part of the healthcare system. But it's become a huge money-making, profit-making machine that stuffs shareholders' pockets and influences politicians' behavior. My first encounter with their tactics was when I entered the mail room when I first started working at the Mayo Clinic. And there were mail bags stacked to the ceiling. And I said, "What are those?" "Those are drug samples." I called up the Drug Manufacturers Association and I said, "Can't we stop this? There's no room upstairs in the doctor's offices. There's no place to put them." They said, "No, we can't stop this." I said, "This is a lot of money." "We know." I said, "We're going to incinerate them." They said, "Go ahead." My second example with the drugs was while I was working at Kaiser. We had to put a tight control on the drug salesmen because they wanted to come in, offer gifts, trips, honorariums, etc. to the doctors who used their products. So all of these promotional efforts just added to the growing immensity of the drug costs. It's been obvious for some time the cost of health care in this country has been rising more rapidly than anywhere else in the world. People have spoken about that in previous testimony. All over the years, there's been efforts to reform health care. President Truman tried it, President Nixon tried it, President Clinton tried it, And all of them met with horrendous opposition from established interest groups and misguided attitudes. There have been some successes with Medicare, Medicaid, Affordable Care Act, but the system is still fundamentally flawed, just as it was when I started. Expenses are excessive, and millions have no coverage at all. Meanwhile, the for-profit segment of the healthcare business continues to rake in billions and billions of dollars. The most recent reform effort, as people have mentioned before, is a bill in the Senate, U.S. Senate, to expand Medicare, to cover everyone. Unfortunately, our twisted national political situation, this bill's doomed to failure. So, many other states are trying to find solutions. Oregon has already made significant innovative changes in our health care, in the way we deliver it, finance it, and the Oregon Health Plan is a single-payer, government-financed system, and it already covers 25% of the people in the state. So why can't we move on? This aging idealist hopes to see every Oregonian covered by a state-funded single-payer system soon. Previous testimony has described why the passage of Senate Bill 631 is important to individuals, families, and businesses, and how it's linked to House Bill 2828, the study bill. So my plea is to give this serious consideration and make it happen as soon as you possibly can.